Hello and welcome to the panel at DublinBIC. Today is Wednesday, the 6th of May 2020, and I'm delighted to be joined today by the founder and CEO of SilverCloud Health, Ken Cahill. Ken, you're very welcome.
Good morning. Thank you for having me.
And indeed, morning. You're based in Boston, and it's quite an early start for you there. So thank you for joining us and taking the time. Ken, SilverCloud Health, founded in 2012, you're a digital mental health platform. You have 300 organizations using the platform, 350,000 users. You've offices in Dublin, London, and Boston. You've taken in $30 million in investment into the business, including $16 million just last month, April 2020, in a Series B round. So my first question to you is, how does one go about closing a funding round during the pandemic?
Yeah, it's very challenging. We were out on the road for kind of 12 months doing a fundraise. We were focused on US investment because of the size of the opportunity, the size of the US health system is quite significant. So we wanted to bring on the real textbook definition of value add, smart, strategic investors, which thankfully we did. So all the vast majority of investors who came in on this Series B were existing customers. Some of them were customers since 2016 and 2017. So they got to use SilverCloud, deliver it, deploy it, and I suppose believe in it and then follow through in terms of investment. Yes, we're on the road. So myself and two other colleagues, Kevin and Leon, we pounded the streets all over the US. In fairness to the other guys, we kind of set up a process, like a sales process, sales pipeline. We had an investment pipeline, and interest all the way through to pitching, to follow-on pitches, to data rooms, to due diligence, and then through legals, and then to close. So I think if you don't do a proper process on it, you will come a cropper just through and under the weight of requests and individual needs and wants. In terms of the pandemic reference, we closed just at the start of it. Nobody knew what the pandemic would do to business from a sort of macro level. Of course, we're in the area of virtual delivery of access to healthcare. So what we've kind of seen subsequent to it, or even start with the closing of the fund, was that what SilverCloud was doing, which was better access, better outcomes, and the ability to reduce costs of care delivery, we were seeing the benefit of that come to fruition insofar as you can deliver all this access, provide it in an environment which today needs it more than ever before, and tomorrow and 12, 18, and unfortunately 24 months will need it even more as well then. So the fundamental, from speaking to investors, the fundamental that they've said to us is good businesses will always get investment, even in poor times. Is the challenge more? Yeah, definitely. So we're very happy to have the funding done.
So, Ken, that's a great insight you've given us, that, even for quite an established business such as SilverCloud Health, you had a really formal process there to do the investment. You said there was a 12-month lead into it, and you set it up like a sales pipeline. You managed all the leads to manage all the inquiries coming in. You had your data room and so on. And, there is a lot of inquiries and requests for information that come in. So you really have to be set up to do that, which is a great insight, I think, for many of the viewers of this discussion. If I can ask you, with the investors in the current Series B round, what was the supercritical criteria that they were looking for to say, yes, this is a definite, we want to go with this?
So with the with the investors who came in as part of our Series B, the majority of them were existing customers. They're all very either healthcare focused and healthcare specific investment funds, or they are healthcare systems innovation arms or investment arms. So their criteria would be similar, but may even shine a heavier light on: is this truly validated? Is this truly researched? Is this truly able to demonstrate impact? Are they able to scale delivery? Are they able to show value of care? That is key for them. I think that was the biggest criteria for the investors. Our research background, our research history that we spun from, have we kept that alive through the company in terms of innovation? And I suppose, have we kept that kind of mission-driven approach still with us? So I think all those coupled together with what is the market need, is it still there, is it still established in terms of delivery, was really important.
Very good. SilverCloud Health started out in Dublin, and you raised funds in Dublin very successfully, including from DublinBIC, who's an investor in SilverCloud Health.
That's right.
Can you talk to me about the difference between fundraising in the US and fundraising in Ireland?
Yeah, I think they're similar. I think it's just a different size of pool and pond. I think it's probably a little bit longer to get all the names of all the people you want to speak to in the US together than versus in Ireland. You can speak to somebody who knows somebody who knows somebody more typically. I mean, all investors in Ireland, in the UK, Europe, or in the US all follow the same thesis, or what we've found follow the same thesis of need, want. It's either the product, the market, or our ability to deliver are the kind of three big areas. So yeah, we kind of narrowed it down sector by sector, be it by check size, be it by do they come in, are these earlier, are these mid, are these later, is this growth equity, is it private equity, is it venture funding, check size, competitors as well, are they in competitors of ours or in adjacency areas, and that allows you filter down quite quickly to your top 100 maybe, and you then use that then to sort of approach. And then I suppose, like any relationship, but bringing investors on board is a long-term relationship. You got to make sure it works. The dynamics have to be there. The relationship has to be there. The interpersonal skills have to be there as well between everybody, because you're not just getting a check off these people. You are getting their insights, their knowledge, their contacts. You're kind of lie down with dogs, get up with fleas. If they are highly respected tier one investors, but they're not considered to be renegades or mavericks, you will get a little bit of that reputation too. So you got to be careful who you hang out with. The investors we brought on board, an eyebrow will raise when we kind of talk about, oh, okay, they're good guys, they're really good guys. And then seeing the commitment from some of the earlier investors come back in a number of other times afterwards is kind of really a sign of validation. So I think it's look beyond the immediacy of the check. What's the value add? What the long-term relationship will be with this group, or this dynamic set within a boardroom, because you're going to be together in good times and in bad as well.
They're great insights, Ken. Thank you for that. I hope it'll be suitably scary for people to hear that you started off perhaps with a long list of 100 possible investors before you narrow that down. Obviously, there's a huge amount of work in doing that, and it just underlines the point that you already made, that this is a strategic objective, and you need to resource it appropriately and have the right timelines on it in order to achieve what you want to achieve. And really take on board your point there as well, that it's not just about the size of the check that's being signed, but who's signing it as well, and what their background is, and what else they bring to the table. I'd like to move on to another subject. We have many clients come to DublinBIC with SaaS platforms, some indeed in the healthcare sector as well. Many of them start off with a B2C, business to consumer view to the how they go to market. That is, that they'll go direct to the user. SilverCloud Health does not do that. Can you tell us about your route to market?
Yeah, so I think even if you think back when we started when we spun out of research out of the NDRC back in 2012, consumerizing access to mental health care would have been almost seen as inappropriate in some ways, versus kind of how much that has moved on to today. But our big, hairy, audacious goal is to be the global leader, delivering the best in terms of outcomes both inside and outside the healthcare paradigm. And we want to get SilverCloud into as many people's hands as possible to improve mental health. So there are kind of two call-outs from our strategy. With that in mind, delivering direct to consumer is a very different part of the brain. It's a different marketing, it's a different messaging, it's a different setup of system that you, without being disrespectful, you have to kind of hook somebody in and bring them through, versus what we have sided on is essentially partnering with healthcare organizations who have a need, who are serving and delivering care to people, to a cohort of different, types of people. So we focus on doing B2B. Now we do B2B2C, where we enable those organizations to deliver to end clients because they have that existing relationship. We've seen many direct-to-consumer businesses fail in this space and even kind of in sort of more adjacent spaces because it's extremely expensive to kind of that direct-to-consumer marketing. And then they're competing for share of voice, they're competing with share of mind. A little bit hard to be a thought leader, a little bit hard to invest in academic and clinical research when you are that direct-to-consumer piece. So we've remained kind of very true to that mission of B2B, but also, of course, as I say, B2B2C, and that's our intention for the future.
So that sounds very credible strategically. But I'm very interested in how you execute successfully on it. In DublinBIC, we have many clients come to us looking to sell into the healthcare sector, and not unusual for them to quite quickly get some traction in terms of free trials or pilots, but typically a very long and apparently non-deterministic sales cycle to actually bring that to a revenue-generating relationship. Now, obviously, you've solved that. So, if you can tell us without having to kill us, how does one do it?
The simple answer is
I'm sorry, let me just to emphasize that, I know that SilverCloud Health is in 70% of the UK NHS trusts.
Yeah, and it's real, I love the expression, nostalgia is history without pain. And being able to refer and look back on 6-7 years work of a lot of very talented people, you can kind of miss a lot of the nuances and a lot of the head scratching pieces, and some of the kind of will this, won't this work parts along the journey. But for us, we always kind of kept, because somebody gave us the advice, which was don't do a free pilot. Or if you're doing a free pilot, make sure there's something in it for you. The reality is the reality. The people that you're selling to, the people you're delivering your platform, your product, your solution to, truly have an awful lot more things on their plate than what you have. Particularly as you're early on, you have a focus of, I want to get this organization using our platform, and then we'll scale from there. When in reality, that person has 50 other projects or 100 other projects, 20 other people that they need to help support, deliver, manage, lead, whatever it might be. Unless there is a sort of pleasure pain, a pain gain part of this for them, they're not going to be incentivized to really roll it out. Now, of course, there's going to be examples of the 1 in a million or 1 in 100,000 that do it. But what we found was, not to do free pilots or free trials. The cost might not always have been money. The cost might have been further validation, further research together with us, publications, ask them for a webinar, white paper, reference. All those elements are of value to you as a business if you can't get that other organization to commit financially to it. So I would say always make sure that they are sharing in motivation, let's say, for this. Otherwise, you'll spin your wheels, and a lot of people just find it. Organizations, they don't want to break your world. They can see the pain on your face in terms of when you go in and you talk about your product that's this, that, and the other, and it's going to revolutionize X, Y, and Z. So they don't really want to say no, and they kind of say, okay, we'll try it. But they won't rally they need product champions or internal support. Get everyone aligned, put a finite amount of time in terms of that rollout. It will be for 6 months, it will be for 3 months, and this is the expected outcomes of it. You are committed. If we hit 80% of those, you will then be a reference, a white paper, a case study for us, and we can use your logo or your name or whatever else it might be, if they can't financially commit. If they can financially commit, it's draw a chart of how they get to 3 years and 5 years with you. And that all of a sudden sorts an awful lot of conversations out very, very quickly. And you will lose more than you'll lose more than you probably you started with by doing that process. There's no good to your business though having 10 pilots that truthfully are going to go nowhere.
Great insights there, Ken. Thank you. It really resonates with me, your point that, you're going into that sales meeting, but you don't know what else is going on in that person's world, and, what's the other pressures that they have on. You're going in with your 10-slide deck and you want to blurt out about how wonderful your product is. But if you don't have empathy with their situation, and if you're not listening more than you're talking, you're possibly not going to make progress. And there's so many things you can do that are really valuable other than a free pilot. And you called out research and other types of engagements, which I think is a great point. You've been very convincing there about how you sell your product to, let's say, one healthcare organization. How do you take it from there to selling to 300 organizations and to continue to be able to deliver to those organizationally in terms of resources? What does it take to go from, the small scale to the large scale?
I can name all the customers we've lost in 9 years of business. There's been very few. I can count them all on, 1.5 hands. That, I think, for me, is kind of part of the organization's, part of SilverCloud's approach, that you need to deliver something that is delivering very significant value for the organization. They need to love you. You need to love them. It needs to be for a longer term. It's not just transactional. If it is transactional, that is what will happen. Into the UK market 6+ years ago, we brought on one customer, and we weren't able to sort of show or demonstrate the kind of, that first one was kind of the first starting customer, and the challenge that we had was, I suppose, was getting embedded in. I think in healthcare delivery, the challenge that you have is you are considered a tangent to the sort of treatment as usual, standard, a tangent to care. Systems, the processes, the de facto, you won't get used, you won't get deployed and delivered. So our first number of deployments in the UK, it felt that was happening. We partnered with an NHS service called Berkshire, which is just outside London, on the west side of London. whereby we partnered with them in the true sense of the word to ensure our product reflected NHS standards, guidelines, frameworks, essentially became almost a chameleon in the NHS. And what I mean by a chameleon is essentially became local, if you will. And I think that's kind of a core part of what we needed to do in terms of, if you don't deploy and deliver and be reflective of the organizations, their local, their local sort of focuses, their local ways of delivering and deploying, you'll always be seen as an outsider. You'll always be seen as a tangent. So we partnered with that organization, and we were able to leverage their network, their smarts, to be able to allow us to bring on neighboring parts within the NHS.
Very good. If I could ask you about the near-term trajectory of mental health care and digital technology within that. You mentioned earlier on that some years ago, it might have even been considered inappropriate to be using digital platforms in this arena. Perhaps that has changed very significantly now with the pandemic and lockdown and so on. How do you see the near future term of digital mental health care?
Without oversimplifying everything with the sort of lens of hindsight, if we look back at how revolutionary Netflix and Amazon Prime and those types of remote delivery services have been, and then we sort of cast our minds back, those who can, to Extravision and to Chartbusters, that type of model of deployment and delivery now seems, why did we go that way, versus sort of, that didn't make any sense, that you go and collect a video or DVD and then return it back 2 nights later, or however long, or else get a fine for it. And then we've seen the Netflix and Amazon Primes appear. Virtual delivery of mental health, I feel, will be the same. SilverCloud is not a silver bullet in terms of the full spectrum of all mental health challenges, but what it is for the 85, high 85, 90% plus of people who are affected by mental health challenges, it can deliver the same level of clinical impact as the more traditional methods. So providing sort of virtual access to care is, I feel, would be sort of seen upon as the same as how sort of rental of DVDs has moved on in comparison to sort of the Extravision versus the Chartbusters or Netflix world.
Ken, if I could finish up by asking you, Enterprise Ireland makes the point all the time that there's a fairly well-trodden path for Irish startups, which is that you win a few sales in Ireland, and then perhaps you go to the UK and the next market. Very commonly that businesses are looking at is the US. And Enterprise Ireland would always make the point very strongly that from Ireland, the US is not a market that you can sell into significantly by phone and email and getting on a plane the odd time, even back in the day when we were able to get on a plane, that you do need to have a presence there, which is obviously what SilverCloud Health and yourself have done. Can you tell us about your decision there? And could you give us an indication of the kind of personal and financial resources involved in making that move?
Yeah, so, myself, my wife, and 2 kids moved over here to Boston about 2.5 years ago now. We had tried a number of moves previous to it, and when you're trying to bring on a market, there's going to be certain people, be it within your board or within the organization, or even yourself, who will have doubts as to this is the right thing to focus on. I mean, the US, no different than other parts of Europe or the UK, have been the graveyard for many Irish businesses. They overstretch, they're fighting on two fronts or 3 fronts. So what we did was we tried a number of locations, in terms of for myself coming over. Healthcare is a very trust-based business. I think all businesses are, but I think particularly healthcare. I think they need to make sure that when they sell, or sorry, when you sell to them, that you're going to be there in 6 months' time or 12 months' time. Somebody to pick out and go, him or her. It's probably moved on a little bit in terms of virtual delivery now than even kind of 10 years ago or 5 years ago. Tried the West Coast first, Portland, Oregon, and the 8-hour time difference, the double hop of each airport to travel around the US. There are things you're not aware of until you actually make the mistake of. Tried Boston then after that for 3 or 4 months, and that felt an awful lot better in terms of multiple flights back a night. I can get back from here to Dublin or to London faster than I can get from here to the West Coast, to San Francisco or LA. So you're really kind of in the center of your business world. What was happening to us just after our eldest was born, so about 5 years ago, my travel level had gone up to a point of it was around 75%. So I was away 75-80% of a year, essentially. And the unfortunate part is I do like my family. So that wasn't going to last. So decided to, if I'm traveling 75% to the US, why not flip it? Why not move to the US, essentially, then travel back 25% of the time? So that's what we did. But you're right, in terms of Enterprise Ireland, in terms of every person who I've spoken to, and even Ronan, who was my mentor, was always sort of saying, you just got to be there. And if you're not there, it's just another reason for them to say no to you. They need to feel that you are committed, you are embedded, you're part of what's here. And selling by vacation doesn't work. So you need to be here. They have enough credible alternatives to your product in some way, shape, or form. You're kind of competing with all the locals. You're at a serious disadvantage if you can't move over here, or some of your team can't move over here. And you kind of sometimes have to fake it till you make it a little bit, which is kind of what we did at the start.
Very good.
You might be here 50% of the time, but they may feel that you're here maybe closer to 100.
Selling by vacation. I love that. That's a new phrase for me. So thank you for that. Ken Cahill, founder and CEO of SilverCloud Healthcare. This has been so insightful on investment, on selling, on the route to market, and on how to achieve scale. I really appreciate it, and I know it's going to be very, very valuable to many startups at a much earlier stage than SilverCloud Healthcare to hear your insights. So thank you very much.
No, thank you for the opportunity, Mark.